So for women
I
who
know.
are still a little bit nervous, knowing that doctors are, not likely to raise the topic based on the research we have, do you have any advice for women about, how can they sort of begin the conversation to get help or?
Yeah. I have a YouTube channel and I talk about like how to talk to your doctor about sex. Number one, I think that you want to try to be clear in what it is that bothers you. Avoid being vague. Like I'll get patients that are like, yeah, it's just a little like, they don't say they say down there. Everybody says down there instead of like my vagina,
Yeah.
or my vulva. If you don't know the terms, vulva is what we see on the outside. When you hold a mirror to yourself, that's everything that you can see is a vulva. It's part of your vulva. You can't see your vagina. That's the inside. That's the inner canal. But we call everything vagina, or we don't call it vagina. We call it everything but. I think so. Being clear, and being direct. It may be difficult to mouth these words to your physician. So practice in a mirror. Like before you go into the appointment, like write it down. I'm going to talk to my doctor, my gynecologist, my whatever about sex. This is what I'm going to say. I have decreased, desire. It hurts when with penetration. The more detail you can bring to the story, the better. For instance, again, with painful sex, when you bring that up to me, I'm going to ask you to describe the pain. Where is it? How does it feel? What positions cause it? Are there positions that don't? Or do other things cause you to have pain? Expect that. Don't be surprised if the first few people you see don't know how to help you and maybe kind of dismiss you. Okay. So expect to maybe have to go through a few different, providers to get to the right, physician or provider that can help you. You can kind of eliminate this or help yourself by using, a great website called ishwish.org. Don't bring up your sex complaint at the end of the visit. Like, you see what I'm saying? Make that its own, honestly.
Make it its own appointment.
Own separate visit. It really needs to be, because it's going to be too easily dismissed.